Shout out to my public health dentist. I know when it talks about dental specialties, orthodontists, oral surgeons, endodontists, you get all the news, but public health dentistry is a special place for me. But I got to call you on your shit just like I call everybody else on my shit, right? And the bottom line is, whenever I go to a public health clinic, I come up to the business people. We're not talking to the dentists that live in a bubble. I'm talking to the real people up front that are running the place. I say, what is your biggest problem? They say, biggest problem? Half the patients don't show up. And see, that's the public health mindset that charging money is evil. What it means is they have no skin on the game. And if you're into public health, if you'd like to transfer more money from the rich corporations and the rich people to the poor, I totally get it. But you can't throw away 2 centuries of economic data. I mean, 1776, Adam Smith, a Scot, a 32-year-old Scot, wrote The Wealth of Nations. And since from there to University of Chicago, it has more Nobel Prize in economics than anyone else. You can't throw away this information. They got to have skin in the game. They make an appointment, they don't show up, it doesn't affect them. Public health, they can't make an appointment. If they don't show, they can't make another appointment without giving you $20 cash as an appointment cost. Now, all the public health people I know, they're like, Howard, that's evil. You're charging poor people for something. If you think having skin in the game is evil, your mind is lost, okay? They're getting free dentistry. Are you saying it's completely free? They have no skin in the game, they don't care? No, they have to have skin in the game or they won't care. So, same thing when someone's getting a hip replacement or a knee replacement. All my Canadian friends brag like, yeah, my mom got a knee transplant. It didn't cost her a penny. Who in the world would think that's a good idea? If that was a $50,000 procedure and all of her neighbors were supposed to pay the whole bill and nothing on her, if she had to pay 10%, so it's a $50,000 bill, she has to pay $5,000. Now she's going to make a smart decision like, do I really need it? Could I take an aspirin or Tylenol? Maybe if I lost weight, maybe if I start taking yoga, or maybe if I left high-cost Toronto and went over to, out there in Alberta, maybe it'd only be 40,000, so then my portion only be 4,000. You have to get people involved in that. It's the same thing when they don't have a copayment. That's where all the fraud is. There's billions of dollars of fraud because no one's looking at the bill because they don't have any skin in the game. So a 10% copayment on anything. Whenever you hear someone in public health say, well, that should be free. When I was in dental school, the government was handing out free cheese blocks. It was a 5-pound block of cheese. Guess what half my neighbors used it for? Football on the way home from school. They'd open this thing up, they'd throw cheese, they'd use it from their garage to stack stuff on. Free has no value. If you're into free, you're into naivety, okay? Everyone needs skin in the game. Thank you.